You're completely right. I think that we're using it very freely, not really understanding the word itself and just the impact that it truly causes in our lives today
Hmm.
and as we continue to grow, especially for our youngins. But I also think kind of go back. So I spoke to a leader. She's probably in her 60s, and I asked her, what do you think about AI in the space of mental health? Right? Because it's being used by young ones
Yeah.
that don't go to therapy, but actually go into ChatGPT. So she says, my daughter actually told me about ChatGPT because she uses it as her therapist. So I ask you, do you think it's a good thing? Because I do feel, right? You mentioned it time and time again, the connection, the communication. That is because of the empathy. It's because we feel seen and heard. That's what we were missing, right?
Yep.
And I feel when you have a chat GPT, I use AI a lot and I love it,
Me too.
but it doesn't give you the empathy. It doesn't give you the compassion. It doesn't give you, and maybe in words it could possibly give you that, but when you're talking to someone, like even this is great, Anne Marie, but when you get to talk to someone in person
Yeah.
and just feel the energy in a room is different. So what is your thoughts on that? AI being that therapist, aka ChatGPT.
Yeah. So I would separate out technology from AI. So what we're seeing with technology and mental health, it's enabling access for people. So if I'm a kid up in some rural part of the US or Canada and I can't get to a therapist, I can contact a therapist online. Is it as good
Hmm.
as in person? Well, I used to be a therapist for youth, and I don't know. I think to have them in person is like way over the top in terms of seeing each other on technology. However, if it's technology or nothing, I want technology because I know just like I'm connecting with you, I can make some relationship building and convey some information and support and caring. So
Yeah.
technology is essential, I think, to transform our mental health systems and improve access and outcomes. And there's some people culturally, I've had people tell us this on Wellness Together Canada and for other people that I've been in touch with,
Hmm.
that they will never go see a therapist. They said, I would never do it. I just can't get past it. Well, then I want you to have something. So, what could you do?
Yeah.
So, the technology is critical. However, AI, we have to understand what AI is, right? Data in, data out. And the problem
Yep.
with AI and mental health is often AI will try to be your best friend and give you back everything you're saying. And if a kid is saying, I'm
Correct.
a loser, and I'll introduce now for people who, just so that they know, self-injury or suicide. If they're saying, I want to do this, and we've had instances of this, that could get
Yeah.
confirmed rather than really dealt with in a professional and effective way to relieve those feelings that lead people to self-harm. And AI might actually confirm, yeah, I understand that you're feeling that way and why. When if I was seeing a young person or anybody, I would want to say, well, let's talk about that. And I'd want to create some hope and move them in a different direction. AI may never do that. And I think with oversight, AI can help us get there. It can help us if people want to be matched to a service and they say, these are the things I like. Maybe AI can pull it up quickly and let them know. But in terms of connection and that being your therapist, I don't think AI is developed or ever will be developed enough to be a person's therapist. I think it can be an
I love that.
information source. I think it can be a connector, but I do not think it is the connection.
Yeah, no, I agree. I definitely agree. I want to kind of go back to this headspace thing. 'Cause I think I don't know if you know this, right? It happens to me all the time, actually, because I'm night scroller, right? I'm laying in bed and I'm just scrolling. That the headspace, it would pull up. I guess as a sponsor, it just knows that I've been on for like
Yes.
an hour or something, and it would just pop up this little bubble, very calm, and saying, "Hey, just let you know, you might want to take a mental break." Like when we talk about resources, there are those things that we
Yes.
could ideally plug in our lives
Yes.
that will hold us accountable. Because I think that's one of the biggest things is accountability around the space of mental health is being able to do the things over and over. And normally with mental health, it is that is getting in this repetition of the way we talk to ourselves, the way that we care for ourselves, the way that we, as see therapies. However, tell me if this is bad. I see people that say I have a therapist on speed dial. And I talk to my therapist anytime something goes wrong, right? And it's like almost once a week. Do you think that's too much? Because there's also a stigma that maybe there's too much of therapy. Where do you fall in line between that?
So, as a therapist, my goal, I always think about it as therapy should be clearing the pathway so people can walk their path. It's not carrying them on the path. It's not even
Mm,
walking beside them forever on the path.
Yeah,
For
yeah, yeah.
periods I have, and I hope somebody would for some periods walk alongside me when I'm really stuck. But then I would hope the whole time they're talking about Anne-Marie, you got this, and you'll know you got it at this time, and we're setting you up to have it.
Yeah.
Because a therapist isn't your friend. A therapist is not your family member. A therapist is not your connector. A therapist is therapy, is a person who helps you get back on track in your life. And many of us fall off at certain times, and some of us need a therapist to get us back on track. And by that, I mean clearing the path with all the garbage, like you talked about, the things we say in our head, or the trauma that's got us stuck, the re experiencing, the negative thoughts, the shame, or the losses. They can
Mhm.
really throw us off our path. And
Yeah.
what a therapist can do is help remove some of that stuff to help us walk back on our path. And what I worry about a lot, and not everybody agrees with me, but what I worry is the jump to what I call intensive services and supports when there's things people could be building into their life that can help them build resilience and confidence and capacity in their own life and model it for people in their community, whether it's in their family, their kids, that they actually show human beings have this ability to recover, to keep going, to learn constantly. And you said something that caught me. I'm trying to think what it was because I answered in my head and said awareness. I think you said it hold us accountable. And in my mind, I was saying it's creating awareness. Like when that little bubble pops up and says,
Yeah.
did you notice you've been doing this? Because we are humans and humans, our thinking gets us caught sometimes and we go around in
Yeah.
circles and we often have a negative cognitive bias. Like I used to ask people in my resilience trainings, I'd say, how many people in the room, when you wake up in the middle of the night, the first thing you think of is what went well that day? Almost
Yeah.
nobody. Most people think about what went wrong that day, unless
Yeah.
they've trained themselves, because human beings have a negative cognitive bias, and that's self protective. That's a threat perception, which helps us see threat, which helps for our survival. So that's sort of like evolutionary psychology, which I
Yeah.
love because many of the things that get us stuck have been set up to support us, but it can
Mm.
go overboard. And that's where a therapist can say, have you noticed this? So I'll give you an example. I saw a person many, many years ago and he had lost his wife and a child, and he was quite depressed and quite suicidal. I'm changing some of the facts to protect confidentiality. But I noticed in his talking, every time he finished his sentence, he would say, life is hard. So he would tell me something, and then he would go, life is hard. And I said to him, I'm sitting here and I'm really listening. And every time you say that, I find myself sinking and sinking and sinking. And now I understand why you feel like life isn't worth living and you want to kill yourself. Like, I wonder
Yeah.
if every time you think something, instead of life is hard, you say something like, I have a daughter and kids who love me. Because he still have people
Mm.
around who love him. That's who brought him in. And so he replaced it. And he told me that. He
Yeah.
said, I never realized I was doing that. So these bots, these bubbles, a therapist can help you see things that you can't see. And then once you see them, you're on your way. Like you don't need someone to keep digging in and visiting the rooms you didn't invite him into and everything else. It's like this is my issue. Someone listens to you or
Yeah.
you put it in your favorite e-mental health technology and you learn it and you go, ah, cool, I get that now. And off you go.